It's time to sit back, relax, and listen to Change Your Attitude, Change Your Life. Change Your Attitude, Change Your Life will inspire, motivate, and empower you. Live your best life now. Listen, learn, think, and decide. Change your attitude, change your life. And now, here's your host, Joan Herman.
Welcome to Change Your Attitude, Change Your Life. You're listening to us in your neighborhood, from coast to coast, and around the world. Thanks for tuning in. I'm Joan Herman, author, speaker, and your host. Change Your Attitude, Change Your Life brings you interviews with some of the most inspirational and influential people in the world. It's our goal to educate and empower you so you can live your best life now. Thank you for taking time for yourself, and thank you for letting us be a part of your life. We have another great show for you today. Joining me is Dr. Andrew Weil, a world-renowned leader and pioneer in the field of integrative medicine. He's here to explain how to be the master of your kitchen and your health. He's the author or co-author of several best-selling books. His new book is Fast Food, Good Food, more than 150 quick and easy ways to put healthy, delicious food on the table. Welcome, Dr. Weil. Thank you so much for joining us today.
My pleasure.
Doctor, your work has literally saved countless lives. You're a pioneer in integrative medicine. In your opinion, what has happened in medicine from the days of our grandparents who used mustard packs and home remedies and the doctors who looked at the whole person to where we've been in recent years?
Well, I think we've lost confidence in the body's own natural ability to heal itself. We've become increasingly reliant on expensive technology, and especially we've come to think that drugs are the only legitimate way of treating illness. And the rise in the use of drugs, both prescription drugs and over-the-counter, I find very alarming.
And doctor, so much of how we live our lives today is making us sick, and there's no question about that. And one of the biggest factors that many people don't pay attention to is what we put in our mouths. So it's so much different today than when I was a girl. I mean, I remember going out to eat was actually a treat, and it wasn't the norm. And now we've reversed it, where a home-cooked meal is a treat. And your new book you just wrote, this addresses the problem. Why is the majority of meals being fast food takeout such a bad idea?
Most people today are not eating real food. They're eating industrialized food-like substances, highly manipulated, processed, refined food. And this is really what's causing us lots of problems. This kind of food gives us the wrong kinds of fats, the wrong kinds of carbohydrates, and not enough of the protective elements that are found in fruits, vegetables, herbs, and spices. As you say, same for me. When I was growing up, our family always sat down to at least 2 meals a day that were cooked from scratch. And eating out was an occasional thing. We didn't eat much packaged food. That has changed drastically. And when I talk to people about why they don't make food themselves, the usual answer that I get is they don't have time or they don't know how.
So what do you say to that person? Because that is the number one complaint that people have. They don't have time or know how.
Yep. Well, the fact is, it is possible to make very delicious food that conforms to good nutritional science in little time, economically, but you have to be shown how to do that. I've spent years trying to convince people that there's no opposition between food that's good and food that's good for you. Many people think that to eat healthy, you have to give up everything you like. That's absolutely not true. And many people think that you have to knock yourself out in the kitchen. That's also not true.
One of the biggest problems is finding the right type of food with GMOs and everything that's processed. How can people make a basic selection to even begin this process?
In my book, Fast Food, Good Food, I give a list of pantry essentials. I tell you what to keep on hand, how to find these things. I try to stay away from really exotic ingredients. But I think, you want to do a little advanced work, so you've got supplies on hand. There's simple tricks for making life in the kitchen easier. You really have to be shown how to do this.
What would you say are some of the most beneficial herbs that we should be incorporating into our diet, and why?
Well, I've developed an anti-inflammatory diet. I think this is the healthiest way to eat because containing inappropriate inflammation is your best overall strategy for good health and longevity. And two of the most powerful natural anti-inflammatory agents are ginger and turmeric. We're familiar with ginger. We're less so with turmeric, the yellow spice that's in yellow mustard and curry powder. And a lot of the recipes in the book show you how to make use of those. I'm also a big fan of garlic. Cinnamon lowers blood sugar. red pepper, chili peppers stimulate circulation and metabolism. Actually, most herbs and spices contain unusual compounds that are protective of our health.
You know, doctor, you'd love me because the minute I start to feel like something's coming on, I begin to eat raw garlic.
Good. That is an old home remedy. Garlic is actually a very powerful natural antibiotic. It kills bacteria, fungi, viruses, also lowers blood pressure somewhat, lowers cholesterol. It's a very good overall tonic, and raw is best. So you want to add garlic near the end of cooking, use it raw on salad dressings. And here's another simple tip. The chemical in garlic that's responsible for these beneficial effects is called allicin, and it forms on exposure to air. So you want to crush garlic, put it through a garlic press, and let it sit for 10 minutes for the allicin to form before you add it to food. If you wait that amount of time and then add it to food you're cooking, the allicin will be stable.
Now, you just mentioned inflammation being a problem today, and you wrote a book called Healthy Aging. We've all been doing a tremendous amount of damage to our bodies, so is it too late for us to reverse the damage that we've done?
No, it's never too late. And at any point in your life that you begin to make changes that support the body's healing functions, you reap those benefits. So if you stop doing the things that are producing damage, you start doing the things that are helpful, immediately you get benefit from that.
Doctor, we asked listeners in advance of this interview if they had any questions for you. And what was interesting is there were a couple of themes that were very common. One of them was thyroid as being a big concern. Why do you think so many people are having thyroid issues today? And what's the best way to treat this? I was at a dinner table with 3 of my friends. There were 4 women around the table, and 3 of the 4 of us were on thyroid medication. Fortunately, I was the one that wasn't. But 3 out of 4, those are really alarming statistics.
Interestingly, I think women are more affected by this. And in the past, women who complained of being tired or had difficulty dropping weight, they were often started on thyroid supplementation without really good diagnostic workup. And once you're started on this, it's very hard to get off. At the same time, there are other women where the diagnosis of hypothyroidism is missed because certain blood tests are normal, even though their symptoms clearly indicate that there's a problem. So I think you want to get the right blood test done. If you are truly hypothyroid, deficient in thyroid hormone, the best treatment is to take thyroid replacement. Usually the drug that's given is Synthroid. I think there are better preparations that replace both of the hormones that the thyroid makes. But if you're in the right thyroid balance, I think it is okay to stay on thyroid supplements long term. And I really don't know of any good alternatives to that.
Doctor, what about autoimmune diseases? These seem to be on the rise. Again, does it always go back to what we're eating?
Well, this is a very interesting question. I think, we're seeing a rise in autoimmunity. We're seeing a rise in allergies and asthma. In many conditions, I think these are going to be traceable to changes in the microbiome, that is our gut flora.
Mm-hmm.
There's more and more research indicating that the organisms that we have in our GI tract are major determinants of our health and our interactions with the environment. And the microbiome in our population has changed drastically in the past, say, 50 years as a result of 4 main factors. One is the incredible overuse of antibiotics. Second is the rise of cesarean deliveries. Third is decline in breastfeeding. And fourth is the increased consumption of this kind of fake processed food that everyone's eating. And I think it is these changes in gut flora that are causing a lot of the conditions that we're seeing today.
So what is the answer then? Is it back to diet?
Well, I think it's certainly getting back to eating real food and getting away from the refined, processed, manufactured food. It's also, I think, avoiding unnecessary use of antibiotics.
Mm-hmm.
And most of the experts in this field that I know recommend eating fermented foods on a regular basis. Mm-hmm. And that includes things like raw sauerkraut, real pickles that are under refrigeration, fermented soy products like miso, fermented dairy products like yogurt and kefir. I think eating these things on a regular basis is very good.
Doctor, we hear so much about the importance of adding antioxidants into our diet. Is it possible to add too much of a good thing?
I think if you're adding these in the form of fruits and vegetables, herbs and spices, I don't think you can overdose on them. If you're taking them as supplements, I think that is more problematic because you can get out of balance, and supplements do not reproduce the whole complex of compounds as nature produces them. But I think if you're getting your antioxidants in the form of fruits, vegetables, things like green tea, red wine, dark chocolate, I think it's fine to eat those as you wish.
And Doctor, to try to move away from the answer of taking a pill for any ailment that comes up, what are some of your favorite home remedies that people should experiment with first?
Well, first of all, let me say there are clearly indications for use of drugs, thyroid replacement being one of them. But there are many common conditions that can be managed very successfully without the use of drugs. And I think that a first step would be dietary change. For example, I have seen many, many patients with chronic sinus conditions, chronic bronchitis, autoimmune conditions who have experienced tremendous improvement just by eliminating cow's milk in all of its form from the diet. And that's a very simple dietary experiment to do to see whether you get benefit, and many people will have that. So dietary change is one of the first things to experiment with.
The book is Fast Food, Good Food, More Than 150 Quick and Easy Ways to Put Healthy, Delicious Food on the Table by Dr. Andrew Weil. If you'd like to get more information about the book or Dr. Weil's work, you can visit his website, drweil.com. That's W-E-I-L, drweil.com. Doctor, in our final moments, what would you like to leave our listeners with?
Just that the food choices that you make are a very powerful influence on your health and well-being, and not just physical health, on mental health and emotional well-being as well. And it's a shame not to exercise that. And it is very desirable to learn how to make simple, delicious food at home that takes very little time, that's economical, and is much, much better than food that's made for you by others.
Doctor, thank you so much for being here. As Dr. Mark Hyman said when he was a guest on the show, it really is time for us to start to visit the pharmacy, F-A-R-M, instead of the pharmacy, P-H-A-R-M. And your book is a great tool to help us start making lasting change. So thank you so much for being here.
You're very welcome.
We'll be right back. Hi, this is Joan Herman, host of Change Your Attitude, Change Your Life. Did you know that Change Your Attitude, Change Your Life has a free monthly digital magazine that can be read online or emailed to your inbox? Every month, nationally recognized leaders in their field provide information to educate, inspire, and motivate you. We believe in a holistic approach to life, incorporating mind, body, and spirit. Check out a copy of Change Your Attitude, Change Your Life 24/7. Visit cyacyl.com and be sure to tell your friends. Thank you for joining us today. We hope you found the show informative. At Change Your Attitude, Change Your Life, we believe that knowledge is power. Take what you've learned, apply it, and live your best life now. Remember that the information provided are the opinions of our guests and should never replace the advice of a professional who knows your personal situation. If you'd like more information, visit our website, cyacyl.com. That stands for Change Your Attitude, Change Your Life. While on the site, listen to past shows on demand, read the digital magazine, and be sure to follow the show on Facebook and Twitter. Until next time, this is Joan Herman. Thanks for tuning in.